let's talk some hand conditions that we frequently treat here at Summit. The fact that we use our hands in everyday life, we're always grabbing and grasping, pushing, pulling, lifting, and when that happens, our hands often will get in the way. A frequent thing that we usually see is what we call boxer's fracture, or a fracture of what we call the metacarpal of the hand. So in this example here, you can see the thumb side over here, the small finger or pinky finger over here, and you can see there's a screw through the middle of this bone here. This is called the metacarpals. These bones are called carpal bones. So these are beyond. So anything that's beyond our understanding is meta. So this is metacarpals. This right here is where we get most boxer's fractures. When people go in for a punch and they usually will hit the knuckle, and where the weakest part of that bone is right here at the neck. So it's called a boxer's fracture because people who are punching usually get that. When that happens, the metacarpals, because of the way that the muscles are oriented, will actually pull tension on this side, which will cause the bone to buckle on the back side. And so that's the typical deformity you have, is this kind of this bending of that knuckle. And so what we do for that is, depending on the amount of rotation and displacement of that fracture, we can either treat this operatively or non-operatively. Obviously, non-operatively is always the better option. If we can avoid surgery, that's always the right thing, which I know is difficult sometimes to hear from a surgeon, to say that surgery is not the right thing. But in this instance, it's one where you don't always have to do it. And what determines whether you need surgery is two things. One would be the amount of the bend or displacement of that fracture. And the second one is if that finger is rotated at all. Because if it's rotated at all, whenever you bend your hand, that part of the finger will actually stick out and get caught on something else, or will scissor in and get caught when you're trying to bend your hand. And so that's often the indications for surgery to fix that boxer's fracture, or realistically any of the other fracture, the metacarpals or the hand bones, if they get crushed or hit in any way. So in general, we'll usually fix them with a couple methods. One is with a screw fixation method like this. We put a screw in the center of the bone, or we can also fix it with some pins that stick in and out of the skin, or we can put pins that stick in and out of the skin to hold the bone in place, and then you can just remove them so there's no permanent device, or we can put a plate and screws on the back of this to hold it in place. The better ones are anything where we can minimize the amount of scarring, and that's the issue with recovery from these hand fractures, is how quick can we get you moving. Now there's a little bit of a tightrope walk here. The quicker you move, the potentially better motion you're going to have and the less scarring, but the more stress you put on the repair of the fracture. If we have you not move as much, it'll heal great, but maybe you have too much stiffness and scarring. And so as we're recovering from hand surgery, that's realistically the biggest issue we have, is trying to find that happy balance between motion and having it heal on its own.